So I'm a gastroenterologist, and I practice and live in the suburbs of Detroit, Michigan. I'm a big sports fan.
He became the Rhodes Scholar representative as well as the homecoming king at Ohio State.
You know, what we're trying to do is replicate what you would have, for example, in my office. You know, we want to be real and answer questions that are tough sometimes. Take a topic and really understand it and develop a solution. At the end, we'll help the patient that's in front of us and also help the patients at home as well as in the studio audience. That's the essence of what we want to do. Hello everyone. Autism. It's a serious neurological developmental disorder affecting approximately 9 out of 1,000 children in the United States. The symptoms can be as follows. Number 1, social difficulty. Infants pay less attention to any social activity. Number 2, communication. Up to 50% have this difficulty, with patients not having natural speech to meet their daily communication needs. Number 3, repetitive behavior. Patients may have multiple forms of this behavior. Autistic patients can have hand flapping, head rolling, or even self-injury. Autism is one of the autism spectrum disorders. The others are, number 1, Asperger's syndrome. That's the closest to autism. Number 2, Rett syndrome. Number 3, childhood disintegrative disorder. Number 4, pervasive developmental disorder, not otherwise specified. All of these disorders have in common widespread abnormalities of social interaction and communication, very restricted interest, and highly repetitive behavior. Very importantly, even though these patients may have symptoms, they don't mean that the individuals are sick or fragile or have emotional disturbance. That's important. I'll say it again, that just because they have these symptoms, it doesn't mean that these individuals are sick or fragile or have emotional disturbance. So what are the causes of this disorder? Number 1, genetic. This is likely due to interactions among multiple genes. In fact, siblings of autism patients are 25 times more likely than the general population to be autistic. Number 2, environmental. Most scientists feel that genetic and the environmental factors interact in this disease. This is commonly seen in many diseases. Number 3, there's no link between autism and vaccines. This can't be said stronger. There's no link between autism and vaccines. One study showed an MMR vaccine causing autism has been shown to be a fraudulent study and been withdrawn. Autism results from changes in various systems of the brain. How this still occurs is a mystery. When we return, we'll meet Ann. Please don't go away.
Well, my social skills were very underdeveloped. I didn't know how to communicate appropriately with people. I was twirling in circles. I was hitting myself in the head when I got frustrated. I got through a lot of temper tantrums.
Welcome back. We have Ann Carpenter with us, and she'll tell us a little bit about her experience with autism. And to begin with, could you please tell us a little bit about yourself?
Well, I am Ann Carpenter. I'm now the Autism Society of Michigan's librarian and information and referral specialist. I've been doing this since 1988 because I can use my experiences as someone with autism and my background in library science. I have a master's degree in library science, which makes me able to do all this.
Well, thank you, Ann, for doing that work. That's tremendous. Let me ask you a question. Do you remember when you were first diagnosed with autism, the first time you were diagnosed with autism?
Well, I was told that when I was a little child at the Children's Psychiatric Hospital Day program in Ann Arbor, Michigan, I was given the label of autism, but then when I started talking, they threw out the label, so I got lots of other labels instead. I was thought to be just partially sighted because I had my lenses removed when I was a baby. I was a German measles baby, so when my lenses were removed, when I was an infant, I had glasses, but I couldn't tell the eye doctor what I couldn't see, so they gave me glasses, but they didn't think they worked well for me, so I was in a special program for children who are blind and partially sighted. My second grade teacher was nervous around me, and I picked up on her nervousness, and so I did a lot of challenging behaviors. I sort of did in my other classes, but they escalated because I didn't know how to communicate my discomfort around her. So she gave me a label of emotionally disturbed. I was in an emotionally disturbed classroom. It wasn't until I was 30 that I was given the real diagnosis.
I want to ask you for a second. So 11 years of age, you were given the diagnosis of autism that was taken away, and you had many other labels that were given to you, you described, and then at age 30 again, you were re-diagnosed with autism, and you really had it all along.
Well, when I was 4, I was thought to have autism, but then when I was 11, I was thought to have ADHD, but back then it was minimal brain dysfunction, or I was thought to have brain injury. That was the old term back in 1967 when I was 10.
I see. What kind of problems did you have? It's hard to remember this. When you were 11, what kinds of problems were you having that made them think you had any problems at all? Do you know?
Well, my social skills were very underdeveloped. I didn't know how to communicate appropriately with people. I was twirling in circles. I was hitting myself in the head when I got frustrated. I got through a lot of temper tantrums, and I jumped up and down when I got excited. I had very extreme emotional reactions. And so they knew something was wrong, and I had a feeling that all along that I was different when I was little. I thought that that's just how everyone was, but then when I was at Pathway, I was aware that I was much different than everybody else, and that something was wrong with me.
And it was so difficult for you to make the diagnosis. Let me just tell the people who are watching, is this can be a very difficult diagnosis to make. I mean, I think in modern medicine we do a better job now, but you can imagine, I mean, going through almost 30 years of your life, I mean, and not having the correct diagnosis or the correct treatment for that matter. So it's important, again, if you have a loved one or a family member that you think has that diagnosis, and you're not going to the correct person, because a family doctor sometimes, or a primary care doctor, may not be able to diagnose it. Find the doctor, find the specialist that can give you the help that you need. This is a theme we always have: be advocacy for your health, and treatment early on. And when you were finally diagnosed, how did they make the diagnosis? How did the doctor at age 30 make the diagnosis?
Well, he was a psychologist, and he used observation, and he looked at my personal history, my clinical history, had my records, and he had seen hundreds and hundreds of people on the autism spectrum. He knew what he was doing because he could see that there were so many variations in people with autism, and that was the correct label. He hit the nail on the head, and it changed my life. I felt so much better about myself, and I knew that now that I had a handle on it, now that there was a name for all that stuff that was going on in my brain, I could do something about it. So I read all I could about autism, and I set about making some real changes, being aware of what I was doing, and finding different ways of doing things. And since then, I've been able to make a lot of progress.
That was an important thing you said, so even though you knew that there's something different, and those who are watching, this is an important point. Validation is tremendous. You knew there was something different, but until now, you didn't know what it was, and so you're just lost in the sense that you didn't know how to change it or how to fix it.
Right,
now,
exactly.
When you get the diagnosis, you can say, you know what, I want to attack it. Again, same idea. I want to advocate for my health, and I'll do something about it.
Right, exactly. And boy, that really opened the door to my life. That was like a window, and it was opened up, and the sunshine came flooding in.
Oh, wow, it's great. When we come back, more with Ann Carpenter. Please don't go away.
We can change our brains throughout our life. They say there's this set period when you're a child and then the window closes shut. I don't buy that. The window can stay open for the rest of your life, and I've decided that that can be true for me too, and so I've decided to find ways to work around the autism.
Welcome back. We're talking with Ann about her experience with autism. Now, when you were first diagnosed, it looks like you did a lot to help yourself and read as much as you can. And one thing that those of you who are watching, it's obvious how intelligent Ann is and how methodical. And when you set your mind to do something, you're going to get it done. And that's tremendous. I mean, it's obvious to me. Let me ask you this: how did the doctor who diagnosed you, what kind of treatments did the doctor recommend for you?
Well, he was a psychologist. He said there's no one treatment or cure for autism, so what I decided to do is just find ways to work around it, because I really believe, I'm reading a book about brain plasticity now called The Brain That Changes Itself by Norman Doidge, MD. It was on the New York Times bestseller list a few years ago, and all about how we can change our brains throughout our life. They say there's this set period when you're a child and then the window closes shut. I don't buy that. The window can stay open for the rest of your life, and I've decided that that can be true for me too, and so I've decided to find ways to work around the autism. For example, if I know that I have to go to bed early and I'm going to have a big day, I will get ready for bed first, then check my email before I go to bed. And I did that last night, and it worked. The thing is, I've decided to just be proactive and figure out ways to work around something before it becomes a problem.
Tell us more. You know, for somebody like me who doesn't have autism, I want you to explain that a little bit more. And also for people who are watching at home, you know, what you said, so if you're going to have a big day, you read your email before going to bed. Tell me what that means, because I need to understand. What does that mean? Why does that help you?
Well, what helps me is to figure out what I need to do first so I can get the best results. So what I did last night was I limited myself to 5 or 10 minutes to checking my email. I took my shower and brushed my teeth. I checked my email for about 5 minutes, and then I went to bed. And it was about 8 hours before I needed to get up. And so that really worked. But I had to figure it out beforehand, because there's been a theory of autism being a movement and regulatory disorder, not just in motor movement, but in thought, emotion, sensory perception, and everything else. So I have to find ways to work around it.
So let me understand this. So
I was just going to say, one way I know that Ann works around it, and this is at home and in our office, because Ann works at the Autism Society of Michigan 2 days a week. She uses a schedule, and I think that she's trying to say that she lists the things that she has to do so her day is predictable. So that we do have a wipe-off board at work, so when Ann comes in to work, she lists her tasks on a wipe-off board. So then she's got 1, 2, 3, 4, 5, and she knows exactly what she needs to do for her day to be productive.
For people who want to understand this, that you are actually putting a little notepad in your mind of what tasks your mind and your body has to do in concert, meaning that almost put a little checklist if you know that something important is happening. Because if you don't, then disorder is the enemy of
I may
autism.
lose track, so I want to make sure I stay on track.
Yeah, and have order. It looks like you're really coping very well with your autism. You're doing tremendously well, and you're helping other people with the autism. Is that true?
Right, and I'm finishing up a book. It's essentially finished, but I just want to flesh out some parts and send it to my sister Jane, who's a writer. She can edit it, and then I want to submit it to publishers. And I'm 55 now. That's partly why I'm doing so well, because a maturing nervous system really helps, and the 50s are the way to go, because that's when people really can and do hit their stride in life. And 55 can be a very exciting year. I'm excited about that, and also I'm excited about getting my book finished, and I feel as though I am able to figure out better ways to do things as time goes on.
It seems like you're doing that more and more. If you could tell, those of us who are watching in America about autism, if you could tell them some facts or give them some advice, what would that be? Both for people who are suffering from autism and also people who have family members And lastly, people who don't know much about this disease. So I'll say it again, people who are suffering with this disease, family members of people suffering, and then people who don't know much about this disorder. If you give them some advice, what would that be?
Well, I think it's less of a disease and more of a condition, but because it's neurological and because the nervous system is so flexible and we can respond to different environments over time, we can change and grow and improve. And often they're finding now that people with autism do get better as they get older. They get less anxious and they're better able to process sensory input better, and they seem to be more comfortable. I think I noticed that in Temple Grandin too, the most famous woman with autism in the whole wide world. She has seemed calmer last time I saw her, and she's 10 years older than I am. She was born in 1947. I was born in 1957. But I think that people do mellow out as they get older, and I think a lot of people with autism get mellow as they get older. And it's hard to know which treatments work for which people because autism is now considered a spectrum from very severe to very mild. So it's really hard to know because there's so much variation from one person to another and from one year to another. I'm different than I was last year. 5 years from now at age 60, I'll be different. I may even be married by then. I may even find that special someone this year. So the door is wide open.
You're hitting your stride at 55. That's great.
Yes.
Right, definitely. I think I'm hitting my stride.
Did you have a thought for us?
Yes, I was going to say, when people do call, and I do hear Ann on the phone, she always stresses that exercise and movement is really, you can't go wrong with that. You always mention keeping a schedule, keeping predictability in your life is very, very important. You always stress occupational therapy for sensory reasons, if that seems to be something that is a problem for an individual child. And you always stress some sort of communication help.
Definitely.
If there's speech and language therapy that could be centered in there, you always do mention that. So there are things that Ann does suggest to parents who call.
That's fantastic. Thank you both very much for coming and Ann for sharing your experience with us. It just shows, that if you are, again, an advocate for your health care, learn about your disease, study it, and say to yourself, I'm going to beat this, you will. And I'm so happy that you came on our show. Thank you very much. My pleasure.
It's been my pleasure.
It's been ours. It's been ours. Thank you.
Thank you.
When we return, we'll hear from Dr. Sally Burton Hoyle, Professor of Neurology. Please don't go away.
I had the pleasure of growing up with a brother with autism, so my entire life has been that which I'm learning about autism and the spectrum of autism.
Welcome back. Now we have on the show Dr. Sally Burton Hoyle. Thank you very much for joining us. Can you let the audience know a little bit about yourself so they can have a good idea of what's going on?
Yes, and my name is Sally Burton Hoyle, and I'm a professor of special education at Eastern Michigan University, where we have started an Autism Collaborative Center. I had the pleasure of growing up with a brother with autism, so my entire life has been that which I'm learning about autism and the spectrum of autism. I'm married and have 3 children, and I'm busy helping shape tomorrow's professionals in the area of autism. At our Autism Collaborative Center, we've got special education teachers and speech and language therapists, occupational therapists, social workers. And why we developed this center was because people were exiting college to be a helper in some manner and not understanding what autism was.
Helper in what way? How do you mean?
Well, if you have, if you're a family and you've gotten a diagnosis of autism with your child, and then you begin experiencing any sort of family troubles, and you go to a social worker for help, such as a social worker might give, if they don't understand what autism is, they're probably not going to give very good direction to the family. And because autism is so misunderstood, they often think that the family doesn't understand how to discipline. And really, it's understanding autism. And the same thing with speech and language therapists and social workers and psychologists. If they don't understand autism, as well as obviously teachers, they need to understand autism, and special education teachers as well.
I see. Now, you watched some of Ann's story,
Yes.
right? What did you think of that?
Oh, I think Ann is phenomenal, and I've known Ann for about 18 years. She worked for me when I was at the Autism Society of Michigan as director. I think that I've learned from her, as anybody smart learns from an individual on the spectrum. People with autism are the teachers, and they are the ones who most likely we're going to get the best information from, whether they're verbal or not.
Yeah, and what she said was great. What I liked about her is that she didn't set any limits for herself. You know, and she said, what was her statement? She said, you know, that I'm 55 and I'm just peaking, you know.
Right.
And how important is that? I mean, it's important for any disease. For those of you who are watching, it's important for any disease to have goals. But for this disease, specifically, you know, to have goals and set them up, and tell me your thoughts on that.
I think it's vitally important, and unfortunately, when a family gets a diagnosis of autism with their child might be beyond the age of 3. It's very common for people to not get that diagnosis, and then it's a spectrum disorder. If the child has language, it's usually missed until later. So if your child is diagnosed at the age of 8 and they say, oh, you've got to get help by age 3, that is very upsetting to families, and as Ann was talking about, their learning occurs throughout life. I have a big poster in my office that says it's not where you start, it's where you finish, because families need to be inspired by people like Ann, Temple Grandin, other individuals like that who really are the experts. You know, the journey in life when you have autism is different for every single person, whether you have, and it's an unfortunate term when we talk about high functioning and low functioning, because if you are a parent of a child that is not verbal and you hear people talking about the term high functioning, it's sometimes a knife in the heart. You feel like, oh my gosh, my child doesn't talk, they're never going to talk.
Disheartening, very disheartening.
It is very disheartening, but families need to know, they need to be inspired that with the correct kind of supports and involvement with typical kids and the family understanding what autism is, that there's a good ending to the story.
Now, you made a good point about individualizing the therapy, because you said that hard and fast rule, treat by age 3,
Right.
it doesn't always apply. No. But looking at the whole spectrum, is it important that if you can treat earlier, is it better? Now, of course, you can always learn and the brain always can adapt, but is it better to start earlier?
I think it's always important, and it's especially important for families to have that reassurance that we've got this diagnosis, but we are doing every single thing that we can. Families need to individualize the supports and services that they do for their child. There are the Office of Special Education Programs in DC. There's something like 40 evidence-based practices that are available to teachers and families, and there's wonderful websites which train you how to do it. Sometimes people are misinformed that there's one kind of therapy, and there is no one size fits all in autism. So the earlier families can begin to approach supporting their kid, the better that they're going to be. They're going to be happier knowing that they're doing what they can. It's very important that when families first find out they have a child with autism, and I don't go with the death and dying model. As you had talked about, nobody is sick and fragile. Families need to understand they need to kind of go through a why me stage. Then they need to seek mastery. They need to go to workshops and read information that is positive, that is evidence-based, and then only then can they have some acceptance and understanding that this is my kid and I love him and he's fun. And the greatest gift I saw my dad with my brother was he would laugh and have fun with my brother. My brother was nonverbal and then had some limited language the older he got, but my dad enjoyed him, and that's a gift. They
loved him.
Yes, they did, and I grew up seeing that it's not where you start, it's where you finish as well.
And important points that you brought up is, number one, try to start as early as you can, but individualize it, individualize the therapy, and then love, it can't be stated, more clearly that, just because you have the diagnosis,
Right.
obviously, it is very difficult for families.
It is.
But even with that, try to make the best of it. Become, again, same thing I've been saying the whole time. Become an advocate for your child and for yourself. Learn as much as you can, and make it the best you can, like with your brother. So when we come back, we'll have more with Dr. Boyle. Please don't go away.
But it's not a common story that families get any sort of help initially from a screening from a pediatrician.
Really?
I've not heard, it's not very common.
Now we're back again talking with Dr. Boyle on autism. One question to you: how has this mandatory screening, or at least a recommended screening in the U.S., help the diagnosis of autism in children?
I think that it all depends. The screening depends on the experience of the pediatrician or family doctor, because depending on the amount of time and the preparedness of parents, if a parent is already looking for the signs and they approach their pediatrician with, I think that I see trouble with this area, in the area of communication, socialization, there's going to be a higher likelihood that the pediatrician will take the time to stop and look at it. But it's not a common story that families get any sort of help initially from a screening from a pediatrician.
Really?
I've not heard, it's not very common.
Why do you think that is?
I think that maybe everybody's pressed for time. And depending on if a family's really scared of what kind of we call in the autism world the A word, they are scared. They're scared to admit it to themselves, and they're scared to then actually it takes a lot of gumption to say, I think my child might have autism. And then for the doctor then would take a parent, very seriously and then look at that. But I've not heard very many stories. I instead hear more stories about other people making that diagnosis in families than finally having to go to a neurologist or a psychiatrist.
Are the screening criteria adequate in your opinion?
I think they are, but again, it's depending on the experience of the doctor. And if they've done residencies and had experiences with people who'd treated people across the spectrum, the clinical psychologist that Ann talked about, Dr. Maltz, had seen hundreds and hundreds of people on the autism spectrum, so he knew that even though she had language, that she still could have autism. And many people in the medical profession still don't understand what really people in the full spectrum can look like. And again, they hear language and they hear initiating conversation and they think, oh, this person's initiating conversation, they can't have autism. But what are they initiating conversation about is what somebody skilled in what the spectrum looks like would look at.
And maybe for those of you who are watching may not have followed, they said, they have language, because so many people feel that if you have language skills and communication skills in the beginning, I talked about that as one of the diagnostic criteria, but what you're saying is like every other disease, there's a spectrum.
Right.
And not everybody's going to have everything. And also, like you said, what are they initiating language with? Maybe talk about that a little bit more, because you may have other people that are being misdiagnosed and really do have autism.
Right, and if you look at the DSM, it looks at some of the characteristics exhibited either before age 3 or after age 3. So you have a child with autism and they're 4 years old and they're talking, but mainly they're just using nouns as opposed to verbs. That would be one example. Also, it would be the pragmatics of language, of knowing when to talk and when to be quiet, and how to get somebody's attention. There's nonverbal communication, which is critical. And people with autism, many times it just goes right over their head. So somebody says something to them, or somebody gets mad at them, they don't understand what that person means by that, because they don't read the eyes. They don't make eye contact.
The social skills.
Yes, and that has a great deal to do with how they understand the reciprocity of communication and language and social and empathy and all those sorts of things. That's one of the first things I look at is that individual reciprocal? And they can be taught reciprocal skills, but it's not intuitive.
Got it.
Ann's mother was a pioneer. My mother had been a pioneer in that when you got the diagnosis of autism back in the 60s, it was 2 out of 10,000, something like that, here in America. And they were given, they were told to put their children in institutions.
Oh, wow.
So now
Come a long way.
We've come a long way. We need to go further, though.
Great information. Thank you for spending the time with us.
Thank
I
you.
appreciate it. When we come back, we'll answer some questions from the studio audience. Please don't go away.
I know you've said that vaccines don't cause autism, but I've also heard that many children are diagnosed at the time of vaccination. So why does something like that happen?
It's a great question. What do you think?
Well, I think that it's coincidental.
Welcome back. It's now time for us to take some questions from the studio audience. Yes.
Why does the U.S. have such a high rate of autism compared to the rest of the world?
What do you think?
I think that there's a neurological explosion, as neurologists and psychiatrists have told me, and it is higher everywhere. But why it's higher here, I think there are more individuals being diagnosed, but I also think our screening, because it's autism spectrum disorders, we pick up more likely kids and individuals who have language and people across kind of the cognitive impairment spectrum as well.
Maybe you can, just to follow up, maybe you can let them know a little bit about autism spectrum disorders, and we haven't touched on that, and why that would make it more prevalent.
Well, as it's communication, socialization, behavioral excesses and deficits, it used to be, that a person was nonverbal, that they rocked, that they banged their head against the wall, that they had little to no meaningful interactions at all. Okay, and now we've got people who have some communication and socialization interaction, and maybe it isn't great, and maybe they're not very meaningful, but they are still doing it compared to nothing.
I guess, the idea is that the definition is not in a box anymore,
Right.
so they can. So if it was outside the box before, it didn't fit, you were nothing. You didn't have any disorder. But now, when you expand it to the autism spectrum disorder, you actually fit in something, and then you can be counted. Right. And so, and we talked about in the beginning of the show that in the UK, they wouldn't screen somebody for autism until maybe a family or a doctor would direct it. But now, if you're screening at 18 months and 24 months, I believe, then you can pick up more. That might be part of the story. Next question. Yes, sir.
I know you've said that vaccines don't cause autism, but I've also heard that many children are diagnosed at the time of vaccination. So why does something like that happen?
That's a great question. What do you think?
Well, I think that it's coincidental that neurologically at about 18 months is when there's a lot of different activities that happen to the brain. And so it's a coincidence more than anything. If you took kids that did not have autism in any way, at 18 months there would be a change in behavior. So every possible body has proven that vaccinations do not cause autism. Still, people want to believe that sometimes, and sometimes it's a difficult sort of argument to make. I usually won't, because if a family truly believes that, it's maybe they're coping with their child's diagnosis in some way. And my brother was diagnosed with autism. He didn't have vaccinations till he was like 3. My mom was exposed to rubella when she was pregnant. So you know, kind of the counter to the
Exactly.
argument.
So the idea is that maybe it's the same time frame as when you're giving the vaccination, that some of these disorders are actually looked at. You know, maybe it's the same time as we're screening these kids at 18 and 24. The vaccination schedule happens, so you say, oh my gosh, you got the vaccine, and they screen at the same time, must be the vaccine. And the only one that was actually even a thought that there was some vaccination that was causing or related to this was actually withdrawn because it was a fraudulent study. It's important to know that, because people quote that we found out that it was actually not a study that was valid. Next question, please.
Hi, I have a friend who has a child with autism, and her child is on a gluten-free diet, and she said it really works. What's your thought on that?
Yeah, have you heard that?
I have heard that. I've heard it anecdotally, but I don't think it's been proven research-wise that gluten casein-free diets. However, it's not anything that's going to hurt an individual. So, you know, I say, why not? It's most helpful when the entire family goes on the gluten casein-free diet. There are complaints about that it's expensive to buy. You know, the materials to make the gluten casein-free things, but there's nothing that's going to hurt anybody from being on that diet, but no research that's proving it.
And that's the key. You know, families will come and tell you that there are certain treatments that help them anecdotally, and that's a key point. If it doesn't hurt them, what's the harm? And obviously, you know, if science proves this is something that actually is beneficial in some manner that we can prove, that's great. But if not, the other therapies as well, they'll tell you that, you know, we talked about in the beginning, what about art therapy? I mean, it's hard to prove that if everybody who has autism or the autism disorder spectrum, that spectrum disorder, that they have art therapy and helps them, it's hard to prove that. But individually, if it helps, what's the harm?
Right.
And let's make it happen.
Exactly.
When we come back, more questions from the studio audience.
There are many interventions, many treatments that really are quite low cost.
This is how fun. Welcome back. We have more questions from our studio audience. Yes.
Hi. What's the difference between autism and autism spectrum disorders? Are they the same?
You know, we touched on this a little bit, but maybe we'll go into it again.
Well, autism is a very specific disorder, and it's differentially diagnosed, that there are specific criteria for autism as opposed to the autism spectrum disorder, and PDD-NOS, which is another thing that is also on the ASD, considered an ASD, but its specific criteria needs to be met for each label to be given.
So the PDD-NOS is a pervasive developmental disorder not otherwise specified. The key is in all this is that now, and Ann said it very well, you know, what happens is that you have these ideas and you know that something's different about you, but you're never given a reason why. And what these disorders now give you is a way to be treated, is a way to be saying, you know, it's not that I'm just so different that nobody can help me, but rather, and she put it really well, is that she said a window was open for me, and now I knew that I could study this and be an advocate and actually get some treatment for this disorder. So I think that's excellent that we can do that.
Right.
Next question, please.
I've read that removing mercury and toxins from the body is helpful in autism. Have you heard this, and is it true?
Dr. Hoyle, what do you think?
I've heard of this, but I know many families who've spent a lot of money with this process called chelation, but there is no evidence that backs up that actually causes any sort of difference. It's anecdotal. There are some people that might have experienced some positive results, but there's nothing solid in medical research or any other place that I know of regarding that.
It's absolutely true, and you know, in some cases it's actually dangerous. There have been actually some adverse effects from chelation therapy. So, you know, here's the problem. You know, when you take care of these folks like you do, it's very frustrating for some families, and you're looking for some way to cope, and you're looking for some way to help your child. But what you have to remember is that, try to do your best and be educated and look at things that work. Because, you're all sometimes grasping at straws, and anything that anybody tells you, you want to jump on because you want to help your child. But at the same time, remember that until it's proven, and again, it's not dangerous, you really shouldn't do it. There are many other types of therapy that we talked about that could actually work. And as Ann said, your mind and your brain will continue to develop, and who knows what the possibilities are. So next question, please.
Treatment for autism is expensive with everything involved. Are you aware of any funding assistance for families?
What do you think?
I'm not aware of any specific sort of funding assistance, but I also know this, that there are many interventions, many treatments that really are quite low cost. Families need to look at their child, identify what their greatest needs are, and if they're in the area of communication, they need to work with a speech and language pathologist. If they are with sensory issues, if the child's really bothered by loud sounds, then an occupational therapist that does sensory sort of processing. There are other sorts of interventions that are globally stated by people as being, well, if we do this, your child will be unrecognizable from their typical peers. And those are quite expensive, and they demand many, many, many hours a week for families. But those also are not necessarily proven to do any sort of difference. So we ask families again to individualize and look at what their child's greatest needs are and try to meet those needs through intervention, treatment, and such.
Let me ask, because we talked off camera about some of the resources that are there for example, for when somebody needs to go to another institution or a facility where they can be monitored. Are there any resources for a developmental disorder for speech therapy, occupational, and those type of therapies? There are funding?
If you are eligible, and it comes, each state calls it something different. It's Katie Beckett waiver is what it's called nationally.
What is it, Katie Beckett waiver?
Katie Beckett, and it was a little girl who was in an institution, and the family sued because they said, take that money that you're paying for her to be in the institution and come to the family and give it to the family. And so now in every single state, in Michigan, it's called the Children's Waiver. And if you are eligible for that, then speech and language, occupational therapy, psychology, staffing, respite in the home can happen. So there are a great many resources, but not to go, I don't know of any that where you go to them and say, well, please pay for this therapy.
I see.
So.
But they would provide funding to the family to try to help with some of the resources. Perfect. So you shouldn't let the cost get in the way, because there's been some legislation, looks like, around the country that could help. But this time I'd like to thank my guests, Ann Carpenter and Dr. Sally Burton Hoyle, for stopping by. Thank you so much.
Thank you.
I appreciate it.
Thank you.
When we return, Partha's Prescriptions. Please don't go away. Welcome back. Today we spoke about autism, how it's diagnosed and is treated. What can we take away from today's Partha's Prescriptions? Number one, if you have a child who has signs of autism, please see your doctor. Early treatment may make a world of difference. Number two, become educated with autism. Your knowledge is the key to understanding which treatments can be effective. Number three, please vaccinate your child. There's no definitive link between vaccines and autism. However, not vaccinating your child can place him or her in danger of having serious diseases. Number four, support groups can be critical in having successful treatment. Join the Autism Society and advocate for yourself and your loved ones suffering from autism. They can be reached at www.autismsociety.org. Finally, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. And thank you for watching. If you'd like to know more about today's show, visit our website at www.askdrnandy.com or look for us on our Facebook and Twitter page at Ask Dr. Nandi. There you can find information on today's guests and helpful tools to continue your search for information on autism or our archives of other topics. Thank you for joining me today.